The brain in the bag. I hold up my life-size rubber brain and ask, what's the world record for brain jumping? How high can the human brain jump? The audience is usually stumped. As a matter of fact, the human brain has no legs and thus can't jump. Then I perform a famous phobies ritual. I throw the brain into a large grocery bag and I turn it around to reveal a large printed brain in the bag sign. Since it has no legs, the brain can't jump up and see out of its prison. It can't tell what's outside the bag. It is a high-speed computer that makes 100 million computations per second, but cannot distinguish between truth and fiction. You are its master. It believes everything you tell it. I yell into the bag, I'm in New York. There are 3,000 people in the audience, and it's snowing outside. In truth, I'm in Vallejo, California. There are 70 in this class, and it's 68 degrees outside and sunny. But when you tell your brain that something is scary and life-threatening, it believes you. It does not challenge it, but reacts immediately and mobilizes the body defenses with a massive outpouring of adrenaline. Now there are two things your brain doesn't want to do. It is the basis for all phobias and obsessions. It doesn't want to die, and it doesn't want to be embarrassed. If at any time you perceive a threat to your survival or your ego, you'll get a massive secretion of adrenaline and the host of anxious symptoms that accompany the outpouring. Incredibly, while the brain makes 100 million computations per second, it can only focus on one thing at a time. What it focuses on are thoughts with the highest energy. It focuses on things that make you anxious because anxiety signals mortal threat. If someone bursts into your office shouting, someone in the hall is shooting people with an AK-47, would you, 1, take the opportunity to create that night's dinner menu, or 2, focus on survival, barricade the door, call 911, ask if anyone has a weapon? Of course, you would focus on the latter. When something frightens us, we ruminate constantly. The brain is totally consumed with the topic. In time, our entire being becomes concerned with avoiding anxious symptoms. We are thus in constant preparation for the mortal combat that never comes. It is enervating and exhausting and creates a state of chronic fatigue. That in itself is frightening. We digest poorly. We sleep poorly, constantly on vigil for that imagined saber-toothed tiger that never materializes. The boo voice. Everyone has a boo or scare voice. Its job is to peruse your environment 24 hours a day to find what it is you don't want to find. It acts like a salacious fiend whose job is to demean, deprecate, depress, and devastate your life. It is a devious, taunting bully. I demonstrate the boo by placing a large rubber puppet monster on my right shoulder. While the puppet monster adds a bit of levity to the moment, I then tell the audience, your ability to cure your phobia or obsession is 100% dependent on how well you recognize and deal with your boo. It is so important, you'll be asked to name yours. If you are born phobic, you will never be lonely. You'll always have your boo to talk to. Whenever you are stressed, vulnerable, depressed, or tired, you will hear from your boo. When I began teaching my children's phobies class, I described a scare voice as the phobic voice. Children didn't relate too well to that term. However, I found out that most 5-year-olds had a friend who would hide behind a bush and jump out and yell, boo! So I began to use the boo in the children's class, and they understood it. Thereafter, I used it in my adult classes, and they too understood. I even use the boo in my professional therapists' workshops, and they understand it too, because they had the same 5-year-old friends. Boo characteristics. The following information is so important, I always tell my classes, this material will be on your final exam. There is no final exam, but if there were, all of this material would be on it. The boo has 3 characteristics. 1, it always lies. 2, it always exaggerates. 3, it always catastrophizes. Thus, if you recognize a boo message, and you will very shortly, you will know whatever it said or implied is a lie, an exaggeration, or a catastrophe. It is the boo that is destroying your life. Everything you'll learn in this course will help you to deal effectively with your boo. The boo has only 2 weapons. 1, the WPTs. What will people think? Phobocs, and especially social phobocs, are very concerned with what people think of us. We tend to be people pleasers, and thus we are very sensitive to any perceived rejection. From an early age, we read people very carefully. Every sigh, raised eyebrow, scowl, and frown is interpreted as a personal affront. Up until age 20, we are desperately trying to fit in, and the WPTs are extremely powerful influences. By age 40, we realize what people think is not important. By age 60, we realize people weren't even thinking about us. But we feel so bad about ourselves that we project that negativity onto other people. We will subsequently learn how to deal with the WPTs. 2, the what ifs. The imagined catastrophes generated by this heinous villain. The boo constantly asks frightening what if questions. What if both wings fall off the airplane? Well, I'll tell you what happens. The plane noses down at 16,000 miles per hour, and in 20 seconds you'll be dead. Note, if at any time you die during a Phobies course, you don't have to do that week's homework. I want you to remember that whenever you're concerned about your own safety, here's something truly important. Never, ever answer a what if question. When you do, you'll pay the emotional price in adrenaline as if that event were actually happening now. All worries are what if questions in disguise. The boo plays a game of gotcha. Remember in school how someone would point to your chest and tell you you've got dirt on your shirt, and you'd look down and they'd run their finger up your nose? The next day, and the boo is good at this too, they'd alter the message a little so that you'd fall for it again. No kidding, you got blood on your shirt. You look down and you get that demeaning finger up your nose. Whenever you respond to a boo what if question, you have looked down and the boo gets to run that famous finger up your chagrined face. You're at war with the boo. It's a war of points. Every time the boo gets a gotcha point, you get a shot of adrenaline, and you get to keep your phobia for another day, week, and that infamous lifetime. Don't look down, don't answer what if questions, and you stop the adrenaline secretion. You get the point, and the boo begins to lose its power over you. If the boo says, "What if the wings fall off?" and you look out the plane window, the boo gets a point, you get that proverbial shot of adrenaline, a finger up the nose, and a lifelong phobic disorder. All the boo can do is go boo. As powerful as the boo appears to you now, in reality, it has only one tool: adrenaline, a substance you now know quite well. Adrenaline is a normal body secretion and never leads to death or disease. That it is no more dangerous than marshmallows on your bare feet, and it only lasts a few minutes. If I stay in the situation, the body will habituate and the anxiety will go away. Thus, in reality, I learned this in the kids' class. All the boo can do is go boo. Now, if you were walking down a dark street and I jumped out of a doorway and screamed boo, you would probably be startled and might squirt a little adrenaline. But if I stood there and kept shouting boo, you would accommodate rapidly, yawn a few times, and eventually ignore my ranting. That's it. It can't kill you. It can't make you go crazy. It can't make your dog die or cause you to develop cancer in 20 years. It can't do anything but go boo, squirt adrenaline, and make you uncomfortable. By now, I am sure you're probably an expert on discomfort. Soon you will Soon you will learn 40 or more tools and strategies to further vanquish your tormenting, impotent boo. Boo land. Every phobak has his or her own boo land. It is our own private haunted house. It is our own disaster movie, full of our most feared consequences that we play when facing our fear-provoking phobias and obsessions. We always respond to our boo land rather than to the actual event. I was phobic about crossing bridges. I would get high levels of anxiety just approaching the bridge, while thousands of people crossed it daily without giving it a second thought. People would reassure me that the bridge was perfectly safe. With my perverse sense of humor, I would always think to myself, hooray, I'm cured. Why didn't somebody tell me that before? Nonsense. The script I played, my bridge boo land, went like this. What if, now you know the boo is about to speak. What if you had a panic attack on the bridge, lost control of your car, crashed head-on into an oncoming car, and killed all its occupants? What if you were arrested, brought before the judge, who said, if you knew you were going to have a panic attack, then why the hell were you on the bridge? Then he takes away your medical license and sentences you to life imprisonment. Meanwhile, thousands of non-phobaks are singing opera arias as they drive, nonplussed, across that very same bridge. It is never the actual event that we are responding to, but our scenario, written, directed, and produced by the boo. Phobak personality. Who gets phobias and obsessions? I hope you have your seatbelt securely fastened to keep you from falling out of your chair. Highly intelligent, imaginative, creative, sensitive, caring, sympathetic, empathetic, diligent, awesomely responsible, and accomplishing human beings are the ones who get anxiety disorders. We have to be highly creative and intelligent to scare the hell out of ourselves with our imagined disaster scenarios. Phobaks are good and kind human beings. We make devoted husbands and wives, innovative lovers, loyal citizens, and conscientious workers. But we are born with an annoying biological quirk that makes us vulnerable to developing anxiety disorders. That is our burden to bear. Buddha said, life is suffering, and the goal is to overcome. You will use the same personality characteristic to eventually overwhelm your boo and claim that expansive life you have always dreamed about. Born phobak. How did you get to be phobak? You were born, genetically predisposed, biochemically predestined to develop an anxiety disorder. A wealth of research data documents this. If you give an injection of sodium lactate, a normal occurring blood chemical, to people who have had panic attacks, they develop panic attacks. If you give the same substance to normals, if there is such a thing, nothing happens. If you give one breath of concentrated carbon dioxide to patients who have had panic attacks, they develop panic symptoms. With normals, nothing happens. There's a polypeptide found in our brains called cholocystokinin. Inject that into panic patients, and they develop panic symptoms while normals show no response. Incredibly, when you introduce these challenges to family members of panic patients, even though they have never had panic attacks before, they develop panic symptoms. These disorders run in families. If you have one, your brother or sister may have one too. It is quite likely that mom or dad or both suffered similarly. Your anxiety disorder is not the result of poor parenting. It is genetic. Conclusion. We are born biologically and biochemically sensitive. In actuality, we display a higher incidence of allergies and asthma. We are sensitive to light, also known as photophobia, sensitive to sound, known as hyperacusis, sensitive to smells. We are exquisitely sensitive to chemicals and to drugs and their side effects. I am the cheapest drunk on the block. A half a glass of wine and I am soused. If I drink a cup of tea at 3 o'clock in the afternoon, I won't sleep for 3 nights. A slight exaggeration. But the point is that we are biologically wired that way. One chemical that we are very sensitive to is our own scare juice, adrenaline. People often ask if they have a chemical imbalance. Yes, you do, but you have created that imbalance. Adrenaline, as you now know, is a hormone that prepares you for mortal combat. You don't want a calming drug circulating in your body at the same time that you are fighting for your life. So when you squirt adrenaline, you suppress serotonin, your calmative drug. Almost every drug that helps depression, anxieties, and obsessions tends to raise the level of serotonin. Thus, our anxiety has created our imbalance, and curing the anxiety will restore it. There have been further genetic studies on monozygotic or identical twins. If one twin has OCD, obsessive compulsive disorder, the other twin has a 67 to 83% chance of having it as well. However, in the normal population, OCD occurs in only 2 to 4% of people. 83% would be 20 to 40 times greater occurrence. Let's make it more profound. In similar twin studies, if one twin has anorexia nervosa, which is voluntary starvation, the identical twin has that same 67 to 83% chance of having that disorder. However, in the normal population, the incidence is only 0.5%. Therefore, 83% would represent a 160 times greater genetic risk. There is no question that there is a huge genetic contribution to the development of anxiety disorders. So, dismiss your guilt and shame. You were born to have an anxiety disorder. Depression and addictions. An estimated 30 to 60% of anxious patients will become depressed. Much of this happens because after multiple failed treatments, we embrace that third myth. My case is so severe, so chronic, so unique, that I am incurable. The lack of appropriate treatment and the failure even to diagnose anxiety disorders in over 70% of patients adds further to the problem. Physicians are often focused on the predominant physical symptoms caused by chronic adrenaline secretion, and they order tests to elucidate that origin. Anxiety can and does mimic a host of possible serious medical conditions. As stated previously, physicians are symptom-oriented. They are trained to pursue and treat such symptoms, and obviously, too frequently, overlook their anxious origin. As a result, we phobocs may drift further from conventional medicine in our quest for understanding and a cure. We often accept a host of expensive and unproven approaches. When they fail, it adds further to our despair and depression. As frustrated patients, we may seek our own forms of self-medication, which explains the high incidence of addiction in anxious people. Trained phobocs. The goal in phobies is to produce a highly trained boo killer, a patient therapist. Phobocs are always looking for a safe place and a safe person to support them. At the end of this course, you will be that safe person, and everywhere you go in the world will bring you the tools and strategies that will keep you anxiety-free. You don't need anyone but yourself to cure. Therapists can be effective and supportive coaches, but ultimately you will find that only you can affect the cure. We use the word trained as a mnemonic, where each letter stands for an important phobies doctrine. T of trained is for thought stoppage, a basic tool you use when you identify a boo message. You say stop and immediately employ an anti-anxiety measure. R is for relaxation. You will learn a calmative breathing technique similar to that used in Aikido. It is used at the first sign of anxiety and always after invoking a thought stoppage. You will be asked to practice relaxation exercises daily. A is for activity. Exercise burns adrenaline and makes the heart more resistant to its effects. We will ask you to start a progressive exercise program. A few minutes a day to start, working up to 30 to 45 minutes, 7 days per week. I is for imagined desensitization. The safest place to begin creeping up on your fears is in your imagination. You will soon learn how to construct a gradual approach or hierarchy to combat any fear. N is for nutrition. There is no magical nutritional formula. One should eat a balanced diet with several snacks per day to avoid low blood sugar or hypoglycemia. When your blood sugar gets low, the body secretes adrenaline to raise that level back to normal. Anytime you secrete adrenaline, for any reason, you will feel anxious and may feel you're going to have a panic attack. Therefore, include a small amount of protein in each meal to avoid large swings in sugar levels caused by carbohydrate overloads. Don't drink your stress. Caffeine has almost the same formula as adrenaline. Reduce or eliminate caffeine from your diet. Read your labels. Phobox don't need 8 cups of coffee, Mountain Dew, Surge, or highly caffeinated lattes. E is for eliminate stimulating drugs. These include nicotine, cocaine, ephedra, amphetamines, and marijuana. These have all been implicated to precipitating panic attacks. Unfortunately, large amounts of theobromines in chocolate can do the same thing. A D, desensitization hierarchies. A safe, incremental, safe, controlled, safe way of gradually creeping up on any fear. Did I mention safe? I devote a whole chapter to this topic because it is the basis for curing any phobia and obsession. Calmative breathing. The first night of the phobia group I attended, they showed us how to breathe. I thought, I just paid $1,000 to learn something I've been doing for 52 years. Give me a refund. As a matter of fact, breathing has been a relaxation cornerstone of many of the Eastern disciplines for thousands of years. Phobes breathing is slow, deep abdominal breathing. Breathe in through your nose, hold it for a count of 4, and exhale slowly through pursed lips until you have expelled all the air in your lungs. You can tell if you are doing it correctly by first practicing it lying down with this book on your stomach. At the height of inhalation, the book should have moved upward toward the ceiling. This is the same diaphragmatic breathing practiced by singers and lecturers. In through the nose, hold it, 1, 2, 3, 4, and exhale through pursed lips. Not very dynamic. Wrong. Everything you do has a specific physiological effect to reduce anxiety. For example, 1, breathing through the nose. This slows down the process and counteracts rapid, shallow breathing. 2, holding for a count of 4. Anxious phobocs tend to overbreathe, and worse than that, breathe fast and very shallow from their upper chest, hyperventilation. When you do that, you alkalinize the blood, and that reduces the ability of your red blood cells to give up oxygen. Your brain, which is 1% of your total body weight, consumes 20% of its oxygen. If it doesn't get enough oxygen, it secretes adrenaline. You feel anxious, and the hyperventilation is exaggerated. Counting to 4 is a mild form of breath holding that restores the blood to a normal pH, allows improved release of oxygen from the red blood cells, and improves oxygenation of the brain. Wow, all that just by counting to 4. 3, exhaling through pursed lips. This prolongs and slows exhalation. Eastern disciplines have long known that exhalation is the calming phase. When you exhale, you secrete a drug called acetylcholine that counteracts adrenaline. Thus, the longer you exhale, the more you can neutralize the stress hormone, adrenaline. Finally, anxious people are often frightened because in the height of their panic, they often feel chest tightness and cannot take a deep breath. Of course not. Their lungs are already full from the shallow overbreathing they were doing. Focusing on prolonged exhalation empties the lungs. The 15 pounds of atmospheric air pressure will take care of refilling them. Thus, what sounded like a simplistic exercise has a profound ability to immediately reduce anxiety. At the very first sign of anxiety, say stop, and take a calmative breath. You can repeat this process several times if need be. You can enhance the effect by doing a fast body check with that first breath. Unclench your fists and jaw and do a total body contraction and then relax completely. You want to mimic a rag doll and try to go totally limp as you continue your calmative breathing. Relaxation is a learnable skill that must be practiced. At first, even when you are not anxious, practice the technique several times a day. Use it prior to any situation which might cause you anxiety. It's instantly available, cheap, fast, and effective. It was worth the whole $1,000 course tuition. Relaxation. You can't be relaxed and tense at the same time. Thus, it is important to master the art of relaxation. Purchase a Fobies relaxation tape, see Appendix A. Listen to the tape at least once daily, more if you are facing anxiety-producing, stressful situations. This tape is a combination of Jacobson's progressive relaxation and autogenic muscle relaxation. It takes less than 15 minutes to complete. Experiment to find the most effective relaxation time for you. Interestingly, some patients initially get more anxious when they start to relax. Phobucks have been chronically tense for so long that it feels normal. Sometimes we feel if we relax, bad things might happen. It's like a deer being trailed by a mountain lion. If the deer lets its guard down, the lion will attack. If that happens to you, shut off the tape, do some calmative breathing, and start the tape again. In a short time, your body will adapt to its newly relaxed state. Medications. Bad news. We are always looking for that magic potion, but there will never be a medication that cures anxiety disorders. Some more bad news. There will never be a drug to make you a concert pianist, a world-class golfer, or a black belt in karate. Perhaps even worse, there will never be a pill that will allow you to juggle 3 or more balls. To accomplish any of these things requires learning some basic skills, getting a coach or a teacher, and practicing until you have mastered this challenge. Curing phobias and obsessions demands the same approach. There are no shortcuts. According to the APA, the American Psychiatric Association, the primary initial treatment of anxiety disorders should be CBT, not medications. They have suggested that the only indication for medications is when the patient is too anxious or too depressed to do the work required by CBT. There are several drawbacks to using medications. 25% of phobucks won't take medications at all. They are afraid of physical or psychological dependency. Sometimes they fill the prescription, but end up flushing the pills down the toilet. 15 to 25% discontinue anxiety medications because of intolerable side effects. We are exquisitely sensitive to the side effects of many drugs. Interestingly, 25% of patients show no benefit from the currently available medications. That means only 25 to 40% of patients get long-term useful benefits. Treated with medications alone, 80% of patients will relapse after discontinuation of the drug. That figure is reversed if patients are treated with CBT. That is expected since it is the long-term skills learned through CBT that protect trained individuals against relapse. The most frequently prescribed medications affect serotonin levels. Higher serotonin serum concentrations have an associated anti-anxiety and antidepressant effect. Selective serotonin reuptake inhibitors, SSRIs. There are a group of medications that raise serotonin levels by blocking their removal from serum. They have a strong safety profile, are non-addictive, and are generally well tolerated. They have proven useful in a large number of anxiety, obsessive, and depressive disorders. Prozac, Paxil, Luvox, and Zoloft are current examples. They have a slow onset of action, taking 4 to 8 weeks to achieve effective therapeutic effects. Serotonin reuptake inhibitors. Anafranil, or clomipramine, was one of the earliest representatives. It was virtually the first drug available that demonstrated effectiveness in modifying obsessive-compulsive disorder. Benzodiazepines. There are a series of drugs that have a rapid anti-anxiety effect. Valium, Xanax, and Klonopin are commonly used medications. They are often used temporarily to acutely allay anxiety until the slower-acting SSRIs take effect. Unlike the SSRIs, they have an addictive potential, and chronic high-dosage use may result in habituation and withdrawal difficulties. Beta blockers. These medications specifically block the cardiovascular effects of adrenaline. They are used most often to allay performance anxiety, particularly public speaking or instrument solos. Inderal is the drug of choice. Others. Finally, there are a whole host of available drugs and drug combinations that can often reduce disturbing patient symptoms. Newer drugs are eagerly sought as new and unique pathways are discovered. Medications help many patients to help themselves. By reducing anxiety, patients are more likely to tolerate the challenges of exposure therapy, which is an important component in effective CBT programs. Approximately 1/3 of patients who participate in phobies are on an anti-anxiety medication. They always ask what the prospects are for getting off their medications. If you have had several severe bouts of major depression or a strong family history of depression, it is likely that you'll be advised to remain on drug treatment permanently. However, most patients, if they cure with a combination of CBT and medication, can be slowly and safely weaned off their drugs. Sometimes they have to cure twice. Your boo says, sure, you cured on meds, but you couldn't do it without them. The boo is wrong. The tools and strategies allow rapid reintroduction to phobic and obsessive challenges without medications. Formulas. The formula for creating a phobak is 1. Find a genetically vulnerable human being. 2. Introduce an anxiety-producing thought, image, or urge that the person buys as truth or possible truth. 3. Observe the person who then avoids, represses, suppresses, and tries to prove or disprove that thought. This approach provides the negative reinforcement that starts the patients on the downward cycle toward the restrictive phobia or obsession. Once started, as you know, the phobia or obsession has a life of its own, and if untreated, will generalize or expand. The cure formula. 1. Face your specific fear. The big word is specific. When you study hierarchy formulations, you will understand the significance of that term. 2. Experience the fear. Here I go again. Every phobak hates to hear that requirement. We want the magic wand treatment. I always hold up a damaged magic star wand and apologize that it is no longer working. There is no magic, but there is a precise path that you will find shortly. What every phobak has to find out experientially is that anxiety is not dangerous, that all anxiety goes away, that it is just the result of a normal body secretion, and no more dangerous than marshmallows on your bare feet. You have a flying phobia. If you take 3 Xanax, 2 Valiums, and 5 martinis prior to the flight and fly to New York in a coma, you don't get credit for a phobak victory because you didn't experience the fear. That's an issue with taking any medication, alcohol, or street drugs that diminish your fear. Cure demands the confidence you gain by experiencing your full fear and effectively dealing with it. There are no exceptions and no shortcuts. Have I mentioned that before? 3. Habituate and master your fears. The body doesn't like being anxious. If you stay in the situation, the body sets up a series of chemical changes that return you to your normal state. Like the cold pool example, the body adapts to the stressor. That adaptation is called habituation. If you repeatedly and purposely place yourself in stressful conditions, the body becomes more efficient at habituating. Your initial anxious response is lessened, and the duration of anxiety is markedly reduced. Eventually, your body will stop reacting with adrenaline, and you will have mastered that event. While the disease is purely intellectual in that we can scare ourselves with what we say to ourselves, the cure is automatic. You face your fear on purpose, you stay and experience the anxiety, you habituate repeatedly, and eventually you master your fear. People say, it can't be that simple. The wonderful news is that it is. People always ask me if I'm cured. I always say, I just got back from my 35th cruise. None before my cure. I have now visited over 50 foreign countries. None before my cure. To a fellow who couldn't go 12 miles without anxiety, that is a cure. They then always ask the next question. Do you still have phobic and obsessive thoughts? All the time, but they no longer cause anxiety. So that's my definition of cured. It is not the absence of phobic or obsessive thoughts, but the effective management of your anxiety so that you can live an expansive life. Chapter 1 highlights. 1. You were born to have an anxiety disorder. It's genetic and runs in families. 2. Anxiety is preparation for mortal combat and is no more dangerous than marshmallows dropped on your bare feet. 3. Adrenaline, a normal body secretion, never leads to heart attacks, strokes, or insanity, just discomfort. 4. Your boo always lies, exaggerates, and catastrophizes. It is a salacious bully whose goal is to destroy your life. 5. Anxiety always goes away. 6. Adrenaline effects last only 10 minutes. Stay in that cold pool. 7. Phobocs tend to be highly intelligent, creative, imaginative, responsible, and empathetic, good human beings. 8. The disease of phobias is avoidance. The cure is non-avoidance. 9. The only weapons the boo has are the WPTs and the what-ifs. The only tool it has is adrenaline. 10. Everyone has their own personal haunted house, their boo land. We respond to that and not to the actual event. 11. The two things your brain doesn't want to do. It doesn't want to die and it doesn't want to be embarrassed. 12. All phobias and obsessions are curable. Chapter 1 assignment. Listen to a relaxation tape, 15 to 30 minutes per day. Purchase a commercially available tape or record your own. If you are unable to do either of these suggestions, just find a relaxed place and breathe in through your nose, exhale through pursed lips, and say the word peace or calm slowly. Repeat that for 15 minutes. Do a daily diary. Write about your phobic progress and your phobic victories. List any distinguishable changes in your behavior. Record the times you used thought stoppage or used your breathing to reduce your fear. Exercise daily. Start slowly and gradually build to 20 to 30 minutes of continuous activity. Exercise burns up adrenaline and makes you more resistant to its effects. It teaches you to become comfortable with rapid heart and breathing rates, which are normal byproducts of exercise. Discontinue stimulating drugs, especially caffeine, nicotine, and alcohol. Make a fear list. Make a list of what situations and things cause you trouble. Write down everything that causes you to have fear symptoms, meaning everything that you don't like to do or feel uncomfortable doing. All of these may have a phobic base. 2. Write down the goals that you would like to accomplish. What could you do if you had no fear? Be specific. 3. Identify what triggers your anxiety attacks. What things? Words, pictures, thoughts, or situations? For instance, chemicals or a picture of insects, or talking to authority figures, or asking someone out on a date. List them. 4. On a scale of 1 to 10, list your current level of motivation to work toward a cure. For example, 1 equals not motivated, 10 equals highly motivated. 5. Collect pictures of situations and things that cause you anxiety. You will use them soon to help desensitize your fears. If you can't find pictures, try to find a printed word of the feared object. If that is not possible, draw a picture or write the word that describes the object. 6. Name your boo voice. A whimsical or derogatory slur is appropriate. You'll be talking to it a lot. 7. Reread this chapter several times. 85% of anything read or heard once will be forgotten. You are not crazy. You are not neurotic. You are phobic, and phobias and OCD are easy to cure. Change. Do it. Accept the fact that you are a phobic. Human beings have fears. Normal human beings have psychological problems, and that's okay.